my name is Dr. Lovleen Kaler. I'm an occupational therapist. I love taking care of my fitness as well, physical health, and then I love taking care of my emotional, spiritual, and mental health. So very passionate about that, very holistic person, and that's kind of what brought me to occupational therapy. As an occupational therapist, I use your occupation as the means to an end. So if I'm talking physical health and I'm working with somebody who's just had a stroke, I'm going to use the occupation of getting dressed as my intervention that I utilize to help them get stronger and help them be able to become more independent with that task. So whether that is helping them gain enough strength, enough range of motion with that affected side, or whether it is identifying compensatory methods. So they might need a dressing stick, or they might need a reacher, they might need all of these other compensatory methods to help them complete the task of dressing, but I would use dressing as the intervention. That doesn't mean that we don't use any preparatory methods. So if I do need to do some range of motion exercises, we do those. If we need to do some strengthening exercises, we do those as well. So that is occupational therapy. In terms of an occupation, it's different across the lifespan. So for kids, their occupation is play. So we would use playing some games or anything that they enjoy as their occupational intervention.
How are occupational therapy and mental health related?
Great question. So occupational therapy was actually born out of mental health. The profession started treating PTSD during the World Wars. They used occupation, so essentially it was different crafts and things to help these soldiers deal with their PTSD, which was then called shell shock. So occupational therapy and mental health are in so many ways synonymous. You cannot have OT without mental health.
Have you seen occupational therapy work with the South Asian population?
I've only been working for a year, but I've only had one client from the South Asian population through the OT practice. It's one of those areas that is missed within our community. There's that lack of understanding of what OT is and how our community would benefit from occupational therapy. And that kind of goes as a whole for the profession. Not very many people know what occupational therapy is, even though we've been around for 100 years. It's something that I think that our population, the South Asian community, would really, really benefit from if they understood what it was.
When you do get a chance to work with your clients, how have you seen it work with them?
I've worked with several patients so far on the task of dressing, being able to use the bathroom, taking a shower, these day-to-day activities that we take for granted. And I've had several that are now able to independently complete those tasks. They might need some standby assistance just for safety measures, but they're now able to go use the bathroom by themselves. Something that we don't think twice about. So that's been really, really exciting. In terms of mental health, one of my favorite stories is working with this gentleman. He's in his late 80s, and he recently lost his wife. And he came up on my active list, and I was doing his evaluation, and physically he was stronger than me. I mean, his physical strength was there. He's able to take a shower, able to dress himself, goes to his meals, follows his routine. But I had just mentioned we work on some emotional things as well with occupational therapy, and that piqued his interest. And for the 3 months that he was on my caseload, we just worked on his emotional regulation, and he went from holding all this emotion and this anger to, by the end of it, meditating to songs that he loves, writing in his journal, going on walks, and now he like leads groups at the assisted living facility that I'm at. And for somebody in their late 80s to want to process their emotions and to just see the benefits of that was really beautiful.
Nice. Are there times that occupational therapy might not work?
I might be biased as an occupational therapist. I think the only time that it doesn't work is when there isn't that understanding and the therapist isn't able to connect with the client and really engage them and relay the benefits of what occupational therapy is. That's hard when you're not able to find that common ground. We're not for everybody and everybody's not for us, and that's okay. So I think just in terms of the therapy world, we run into that a lot. I myself, it took me a long time before I found a therapist that worked for me, and once I found her, it's worked. So I don't think it's necessarily the profession, but finding that nice and perfect blend for you.
What are some ways of knowing that an occupational therapist might be right for you?
I think if I'm going to just, speak on my own experience, seeking out a therapist myself and working with so many different clients is someone who actually takes the time to listen and brings in those meaningful activities into your therapy sessions. If they hear like, okay, this client enjoys football, how do I incorporate football into our session? This client enjoys cooking. I actually have one right now who she has MS and she becomes so easily fatigued, but she got so excited when I told her I know how to cook Indian food, and she's like, if we do that for a session, I'll do it. When your therapist actually brings in the things that you talk about, you will know that you have the perfect therapist for you.
You use occupational therapy for yourself, and how has that helped?
Oh my gosh, yes. I OT myself all day long. I'm very fortunate and blessed to be a therapist myself because I wouldn't be, I can't say I wouldn't be as far as I am now, but because I have that background knowledge, because I apply this to my clients, I personally feel like a hypocrite if I don't do it to me. So, gosh, we are really heavy on habits, roles, and routines, especially on the mental health side. I've really had to stop and identify things for myself, what works for me and what doesn't. I'm passionate about sensory processing, which is very huge with occupational therapy, and it gets overlooked because we just associate that with pediatrics and just certain diagnosis, but let's face it, we are sensory beings. We experience the entire world through our senses. So I have identified what my sensory needs are, and I apply that throughout my routine. So I know that I need deep pressure. I know that I need movement. I know that I'm very particular about my schedule. If anything doesn't go as planned, I know that I have to apply my tools to myself. But I've identified what those tools are, and I've identified like, okay, if I know that my week is not going to go as planned, how am I going to be able to pivot? So yes, not to go too deep into like the technical things of what occupational therapy is, but I have had to apply it to myself, and it's really been my saving grace with my sobriety journey. I'm 2 years sober, and I've really only been able to do that because I knew what I was using substance for and what feelings to avoid. So because I know what my sensory needs are, I was able to, in a sense, replace it with something that is healthier for me than substance.
Is there anything else you want to tell us about occupational therapy?
Yeah, occupational therapy is the missing piece when it comes to mental health care. We've unfortunately gone so deep down the medical route to fit in with all of these other medical professions, but it is that one piece that's going to help you take your mental health journey to the next level. It's every single one of us in the mental health world is needed. I know for me, me and my therapist, that's my longest relationship. I've been with her for like 8 years. So I just think that, like I just shared about my journey, I knew what my needs were, but having that understanding of occupational therapy has allowed me to take my mental health care to the next level.
All right. Thank you.
Yeah.